A child having to die before his parents. That's what a few dozen families a year in Singapore face as their children suffer from life-limiting illnesses. Experts in the field of paediatric palliative care say they want more to be done through funding, facilities and training. They say a lack of awareness has held back some parents from opting for the service. Sarah Gross examines the issue in this week's Spotlight.
Bangun tidur ke terus mandikan Daniel.
Daniel communicates using facial expressions. The 17-year-old has a severe form of cerebral palsy. He was referred to Paediatric home hospice care under Star Pals, a service dedicated to improving the quality of life for children with life-limiting conditions.
Hi, good afternoon, Mommy and Daddy. So how is Daniel?
For nearly a year, a nurse has been conducting weekly checks on Daniel,
Thank you.
while a medical social worker meets regularly with his parents. His mother says he is doing much better under the service compared to when he had to be brought to the hospital due to complications.
Previously, before they was with us, we like having difficulties. It's like every time when it's happened to him, we have to call an emergency, we have to bring him. You know, it's like very difficult for us. So right now, I just want him to be happy. And I want him to know that we love him. And we do care for him. If anything happens to him, I just have to let it be.
Star Pals looks after 50 new patients a year.
In the hospital, a lot of times they would be hooked onto machines. They would be sort of in an environment where they might not be night or day. I would imagine overwhelming for a child to sort of face that kind of environment, which is always in flux. After understanding the whole family's needs as well as the child's special situation, we would be able to sort of carve out some kind of breaks, some kind of enjoyment in the smallest way possible. For Daniel, it might be just about going out for some fresh air, which is not something that you would imagine somebody like him can do previously.
In 2004, the Paediatric Palliative Care Service was formed at KK Women's and Children's Hospital. Now, this initiative was started by the hospital's oncology unit, but in 2005, extended to children with non-cancer illnesses. Now, this Children's Day therapy is a facility for stable patients requiring symptom management. Associate Professor Chan Mei-yok is no stranger to the field. The pediatric oncologist estimates there are about 60 children under palliative care a year. Palliative care usually begins when doctors refer the child to the service. A team meets with the family to discuss the kind of support they will need. But Professor Chan says there is often a lack of awareness and acceptance of the service.
It's not just for dying children. I think a lot of people think that once you are referred to palliative, it means that that's the end of the road for you, and that's really not the case. Palliative care really is meant to provide care in terms, not just in terms of physical symptoms. So because of that, there's a lot of taboo, a lot of staff, a lot of parents do not want to be referred because they feel that it means that people are giving up on them.
Nur Aisha was the first nurse in Singapore to be trained in pediatric palliative care. She says the service is not about giving up, but allowing parents a choice. Of the 250 patients she has cared for, she says more than half of them were late referrals.
The earlier the referral to us will be much better for us to manage because the parents they are given more time to come to acceptance. We have more times to build rapport and the bonding and do a lot of exploring, explanations.
Children usually are aware of what is happening, but they don't have the permission to talk about it from the parents. Children can be involved if the parents give consent for us to talk to them. And of course, we will also have to prepare the parents or equip the parents with the right thing to say to children in case in their own time the kid asks the parents like, what is happening to me, am I dying? Yeah.
Depending on their condition, children's voices can be included in an advanced care planning. Now, this is basically a series of conversations between healthcare professionals, the patient, and their family members on the future healthcare plans of the child. And this can range from whether they want intensive care to how they want to be remembered to who should have the belongings when they're gone.
Professor Chan says what is needed is a dedicated hospice for pediatric palliative care. When the new Assisi Hospice opens its doors in 2016, it will have Singapore's first dedicated pediatric ward. It will have 5 beds and a larger room for families. The hospice currently takes in a few child patients and lets parents stay overnight in their family room.
Besides the room size and children features in the room, we will also be having a children's playground and a garden for them to come out and have fresh air. Besides palliative care, that will also include play therapy. We will also have art therapy.
Funding is another issue raised among observers. Star Pals is currently being funded by a 3-year grant from Tote Board. The program hopes to have more funding, which will go towards providing support for play therapists and bereavement care. Going forward, the training of its medical professionals in pediatric palliative care is being enhanced. Dr. Siti starts her training in palliative care in 2015. When she returns, she will be the first doctor to have a dual accreditation in pediatric intensive care and palliative care.
A lot, although not all the patients who end up in palliative care start off in ICU, we see a fair amount over the years. And I believe that if we are properly trained in palliative care with some formal training, we'd be able to support the parents and the patients better in terms of their needs, whether it be physical needs or psychosocial needs. And I believe that these treatment then can be started earlier because, we'd be able to recognize it earlier.
With medical training having more exposure to palliative medicine and infrastructure expanding, much progress has been made in the field of pediatric palliative care. But for the service to be fully integrated and accepted into mainstream practice, healthcare experts say it comes down to not associating palliative care with death, but rather seeing it as an alternative treatment when the cure is no longer possible.